Have you ever wondered why your heart races at the thought of a presentation or why you feel unease creeping in before a significant event? Welcome to the world of anxiety, a common yet often misunderstood companion. Anxiety, in its basic form, is a normal response to stress. It's like an alarm system that goes off when you're under pressure, maybe from work or personal matters. But what happens when this alarm system is always on? When the unease, the palpitations, the restlessness become a constant part of your life? Well, then you might be experiencing what we call an anxiety disorder. It's a term that covers a variety of conditions where anxiety becomes excessive and starts interfering with your daily life. This is where understanding anxiety begins, with recognizing its symptoms, which can manifest differently in each individual. So, what are the telltale signs of anxiety? When it comes to anxiety, the symptoms are as diverse as the people who experience them. Yet there are some common indicators that we can look for. The first sign often lies in a state of persistent restlessness. This isn't your typical run-of-the-mill impatience while waiting for a bus. It's a constant, gnawing feeling of unease that seems to linger even in moments of calm. This restlessness often couples with an increased heart rate. Your heart might start pounding like a drum during a rock concert when there's no apparent reason for it to do so. It's as if your body is preparing for a race that's not even happening. Along with this, you may find yourself breathing rapidly, almost as if you've just run a marathon, while you're merely sitting in your living room. This is your body's response to perceived danger, an ancient survival mechanism kicking into high gear, even when there's no actual threat around. But the symptoms of anxiety are not just physical. They can also be psychological. You might find it hard to concentrate on tasks that once seemed easy. Your mind might be buzzing like a beehive, filled with thoughts that dart in and out, making it difficult to focus. And then there's the trouble with sleeping. Falling asleep might feel like trying to tame a wild horse, and staying asleep may be equally challenging. Your nights might be filled with tossing and turning, as your mind refuses to quiet down. These symptoms, both physical and psychological, can be incredibly disruptive, affecting every aspect of your life, from your work to your relationships. But recognizing them, acknowledging them, is a crucial first step. It's like turning on a flashlight in a dark room. You can't deal with what you can't see. Recognizing these symptoms is the first step towards managing anxiety. But what causes these feelings of unease? Anxiety, like many mental health conditions, doesn't have a singular cause. It's a confluence of factors that can lead to the onset of this condition. Picture it as a puzzle, where each piece represents a different element that contributes to the overall picture of anxiety. One of these puzzle pieces is genetics. Just as your hair color or height can be inherited from your parents, so too can your predisposition to anxiety. Studies have shown that if a close family member has anxiety, you may be more likely to experience it as well. Another piece of this puzzle is brain chemistry. Our brains are a complex network of billions of neurons, communicating through chemicals called neurotransmitters. When these neurotransmitters are out of balance, the brain's alarm system, which triggers our fight or flight response, may become overactive, leading to symptoms of anxiety. Your personality is another significant piece. Certain personality types are more prone to anxiety. For instance, people who are perfectionists, easily flustered, or generally high-strung may be more susceptible to anxiety. The final piece of our puzzle is life events. Traumatic events such as accidents, abuse, or the loss of a loved one can trigger anxiety disorders. Even day-to-day stressors like work stress or financial difficulties can contribute to anxiety over time. However, it's crucial to stress that having anxiety doesn't indicate a personal failure or weakness. It's a common condition that many people face, and it's something that can be managed and treated. It's like having a puzzle with a few pieces that don't quite fit right. But with the right tools and strategies, you can rearrange the pieces and create a clearer, more peaceful picture. Now that we've identified the symptoms and causes, let's explore ways to manage anxiety. Remember, understanding the causes is the first step towards finding effective strategies for treatment. So stay tuned as we delve deeper into this journey towards mental well-being. living with anxiety can be challenging, but it's not insurmountable. The journey to managing anxiety is not a straight path, but rather a winding road with ups and downs. The key is to find what works for you, and that may take some trial and error. One of the most effective strategies for managing anxiety is cognitive behavioral therapy, or CBT for short. This type of therapy helps you understand and change thought patterns that lead to harmful behaviors and feelings. It's like reprogramming your brain to respond differently to anxiety-inducing situations. Medication can also be a powerful tool in managing anxiety. It's not about becoming dependent on a pill, but about using it as a tool to help you navigate through your journey. It's always important to have open conversations with your healthcare provider about your concerns and questions related to medication. Self-care practices are essential in managing anxiety. This could mean different things for different people. For some, it might be a relaxing bath at the end of a long day. For others, it might be a morning run or a yoga session. It's about finding what makes you feel good and incorporating it into your routine. Lifestyle changes can also play a significant role in managing anxiety. This includes maintaining a balanced diet, ensuring you're getting enough sleep, and incorporating regular physical activity into your life. It's about creating an environment that supports your mental health. And let's not forget the importance of seeking professional help when needed. There's no shame in reaching out to a mental health professional. They're there to provide the support and guidance you need. It's okay to ask for help. To wrap up, managing anxiety is not about eliminating it completely. That's an unrealistic expectation. Instead, it's about learning to manage it effectively. It's about understanding your triggers, developing coping mechanisms, and making lifestyle changes that support your mental well-being. Remember, it's not about eliminating anxiety completely, but about learning to manage it effectively. And as you embark on this journey of managing anxiety, remember you're not alone. There's a whole community of people who are going through the same thing, and there's a wealth of resources available to help you navigate this journey. Embarking on the journey towards mental well-being can feel daunting, but remember, you're not alone. It's a path many have walked before, and many will walk after. It's a journey that can be challenging, but it's also one that can be deeply rewarding. If you're wrestling with anxiety, it's crucial to know that there's no shame in seeking help. In fact, reaching out can be one of the bravest steps you take. There are trained professionals like therapists and psychologists who can guide you through this process with understanding and expertise. These individuals can provide you with tools and strategies to help manage your anxiety, and they can offer a safe space for you to share your feelings and experiences. Support groups can also play a pivotal role in this journey. These are spaces where you can connect with others who are experiencing similar struggles. They offer an opportunity to share, listen, and learn from one another, fostering a sense of community and understanding. You may find comfort in knowing that others are navigating similar challenges, and their stories can provide hope and inspiration. But this journey is not a sprint, it's a marathon. It's about patience, about understanding that progress may be slow and sometimes non-linear. There will be peaks and valleys, moments of clarity and moments of doubt. But every step forward, no matter how small, is a victory. Each day you choose to fight, choose to persevere, is a testament to your strength and resilience. And throughout this journey, remember to be kind to yourself. You're doing the best you can, and that's enough. You're learning, growing, and becoming stronger with each passing day. It's okay not to be okay sometimes. It's okay to need help, and it's okay to give yourself the time and space you need to heal. As we conclude, remember, it's okay to seek help, it's okay to struggle, and it's okay to talk about it. Mental well-being is a journey, not a destination, and every step you take is a step in the right direction. In this video, we've delved into the complexities of anxiety, but this is just the tip of the iceberg. We've walked through the common symptoms, from the physical manifestations like rapid heart rate and shortness of breath, to the psychological ones, such as constant worry and fear. We've looked at the causes of anxiety, highlighting that it's often a combination of genetic, environmental, and personal factors. We've also explored effective strategies for managing anxiety. These range from lifestyle changes, therapy, to medication if necessary. The journey to mental well-being isn't a straight path, but a winding road full of ups and downs. But remember, every step you take is a step forward, no matter how small it may seem. Continue exploring this topic and others like it by subscribing for more insightful videos. Remember, understanding is the first step towards acceptance and healing.